time to relax and learn medical, your sanctuary of serenity and science, where peaceful 432 Hertz music meets the power of medical knowledge. Whether you're a medical student, have a curious mind, or a lifelong learner, you've come to the perfect place to study in harmony with nature and sound. Let's begin. Here are 140 medical terms and descriptive definitions of the arteries. Aorta, the largest artery in the body, originating from the left ventricle of the heart and branching to deliver oxygenated blood throughout the body. Coronary arteries, vessels that wrap around the heart muscle, supplying it with oxygen and nutrients essential for beating. Carotid artery, major arteries in the neck that supply blood to the brain, neck, and face. Pulmonary artery, the only artery that carries deoxygenated blood, transports blood from the heart to the lungs for oxygenation. Femoral artery, a large artery in the thigh that supplies oxygenated blood to the lower body. Brachial artery, found in the upper arm, often used to measure blood pressure. Radial artery, located on the thumb side of the forearm, commonly used for pulse detection. Ulnar artery, travels along the little finger side of the forearm and supplies blood to the hand. Subclavian artery, supplies blood to the arms and part of the brain. Axillary artery, continuation of the subclavian artery serving the armpit and upper limb. Iliac artery, divides from the aorta to carry blood to the pelvis and legs. Internal iliac artery, supplies blood to pelvic organs including the bladder, rectum, and reproductive organs. External iliac artery, becomes the femoral artery as it passes into the thigh. Vertebral artery, runs through the spine's cervical vertebrae to supply blood to the brainstem and posterior brain. Celiac artery, a major abdominal artery that branches into arteries serving the liver, stomach, and spleen. Superior mesenteric artery, supplies blood to the majority of the small intestine and part of the large intestine. Inferior mesenteric artery, supplies blood to the distal part of the large intestine. Renal artery, delivers oxygen-rich blood to the kidneys. Gonadal arteries, supply the testes in males and ovaries in females. Common carotid artery, splits into internal and external carotid arteries, vital for brain and facial circulation. Internal carotid artery, supplies blood to the brain's anterior and middle portions. External carotid artery, supplies the face, scalp, and neck with oxygenated blood. Basilar artery, formed by the joining of vertebral arteries, supplies the brainstem and cerebellum. Facial artery, twists along the jaw and cheek to supply the face. Lingual artery, supplies the tongue and floor of the mouth. Occipital artery, supplies blood to the back of the scalp and neck. Temporal artery, runs near the temples, often palpated to detect inflammation in temporal arteritis. Maxillary artery, a major branch supplying the deep structures of the face. Anterior cerebral artery, supplies the medial portions of the frontal lobes and superior medial parietal lobes. Middle cerebral artery, provides blood to the lateral cerebral cortex, commonly affected in strokes. Posterior cerebral artery, supplies the occipital lobe and parts of the temporal lobe. Circle of Willis, a circular arterial system at the brain's base ensuring consistent blood flow to the brain. Arteriole, small branches of arteries that lead to capillaries, playing a role in regulating blood pressure. End artery, artery without a significant collateral supply. Blockage can lead to tissue death. Collateral circulation, alternate pathways of blood flow developed when primary arteries are blocked. Vasa vasorum, small arteries that supply the walls of large arteries with nutrients. Elastic arteries, large arteries like the aorta that stretch with each heartbeat to maintain blood flow. Muscular arteries, medium-sized arteries with more smooth muscle for regulation of blood pressure and flow. Arterial anastomosis, a connection between two arteries that provides alternate blood flow routes. Tunica intima, the innermost layer of an artery made of endothelium that reduces friction. Tunica media, the middle muscular layer of the artery that controls diameter. Tunica externa adventitia, the outermost layer providing structure and protection to arteries. Arteriosclerosis, general hardening and thickening of arterial walls. Atherosclerosis, buildup of plaque within artery walls, narrowing them and restricting blood flow. Thrombus, a blood clot that can block an artery. Embolus, a mobile clot or debris that travels through arteries and may cause blockages. Ischemia, Reduced blood flow to a tissue, often due to arterial blockage. Infarction, tissue death due to prolonged ischemia. Aneurysm, a balloon-like bulge in an arterial wall that can rupture if untreated. Dissection, a tear in the inner artery wall causing blood to flow between the layers. Popliteal artery, located behind the knee, it continues from the femoral artery and supplies the lower leg. Anterior tibial artery, runs down the front of the leg and supplies the anterior compartment of the leg and foot. Posterior tibial artery, travels behind the tibia to supply the back of the leg and sole of the foot. Peroneal fibular artery, supplies the lateral side of the lower leg. Dorsalis pedis artery, found on the top of the foot, important for checking circulation in lower limbs. Plantar arteries, arteries that form an arch in the sole of the foot to supply the toes. Deep femoral artery, branches off the femoral artery and supplies deep structures of the thigh. Genicular arteries, branches around the knee joint providing blood to the surrounding structures. Digital arteries, tiny arteries that supply blood to the fingers and toes. Suprarenal arteries, supply the adrenal, suprarenal glands above the kidneys. Phrenic arteries, supply the diaphragm with oxygen-rich blood. Esophageal arteries, serve the esophagus, typically branching from the thoracic aorta. Intercostal arteries, run between the ribs to supply muscles and skin of the chest wall. Lumbar arteries, arise from the aorta to serve the muscles and skin of the lower back. Median sacral artery, a small artery descending along the sacrum. Pericardial arteries, supply the pericardium, the membrane surrounding the heart. Thyrocervical trunk, branch of the subclavian artery supplying the thyroid gland and neck structures. Costocervical trunk, supplies blood to the upper ribs and deep muscles of the neck. Inferior thyroid artery, supplies blood to the thyroid gland from below. Superior thyroid artery, arises from the external carotid and supplies the thyroid gland from above. Arterial pulse, the rhythmic expansion of arteries with each heartbeat, used to assess heart rate and rhythm. Baroreceptors, pressure-sensitive receptors in arteries that help regulate blood pressure. Chemoreceptors, located in arterial walls, they detect changes in blood chemistry like oxygen or CO2 levels. Arterial blood gas, ABG, a test measuring oxygen and carbon dioxide levels in arterial blood. Palmar arches, networks of arteries in the hand from radial and ulnar arteries. Collateral artery, a smaller vessel that may enlarge to compensate for blocked main arteries. Arterial line, a catheter placed in an artery to monitor blood pressure and collect blood samples. Angiography, an imaging technique to visualize arteries using contrast dye. Angioplasty, a procedure to widen narrowed or blocked arteries using a balloon. Stent, a mesh tube inserted into an artery to keep it open. Coronary artery disease, CAD, narrowing or blockage of coronary arteries due to atherosclerosis. Peripheral artery disease, PAD, narrowing of arteries supplying the limbs, leading to pain or cramps. Hypertension, high blood pressure that can damage artery walls over time. Hypotension, abnormally low blood pressure which may reduce blood flow through arteries. Pulse pressure, the difference between systolic and diastolic blood pressure, reflects arterial health. Elastic recoil, the natural rebound of arteries after being stretched by blood pressure. Sphygmomanometer, a device used to measure arterial blood pressure. Pulse deficit, the difference between heartbeats and felt pulses, may indicate poor arterial perfusion. Endothelium, the smooth inner lining of arteries that regulates blood flow and vessel dilation. Nitric oxide, a molecule released by arteries that causes smooth muscle relaxation and vessel dilation. Vasodilation, the widening of arteries due to relaxation of smooth muscle, increasing blood flow. Vasoconstriction, the narrowing of arteries from smooth muscle contraction, reducing blood flow. Vasospasm, sudden constriction of an artery, potentially leading to tissue ischemia. Arteriogram, an X-ray image of arteries taken after injecting contrast dye. Arteritis, inflammation of the arterial wall, often immune-related. Temporal arteritis, a serious form of arteritis affecting arteries in the head, can cause vision loss. Takayasu's arteritis, a rare disorder causing inflammation of large arteries, including the aorta. Raynaud's disease, a condition where arteries spasm in response to cold, limiting blood supply to fingers and toes. Claudication, pain in the legs due to insufficient blood flow during exercise, often from PAD. If you enjoyed this video, please like and subscribe to be notified of our latest videos. Arteriovenous malformation, AVM, a tangle of abnormal arteries and veins that disrupts normal circulation. Aneurysm rupture, a medical emergency where a bulging artery bursts, causing internal bleeding. Aortic dissection, a tear in the aorta's inner layer, allowing blood between wall layers. Coronary bypass, a surgical procedure to create a new path for blood to bypass a blocked artery. Bypass graft, a vessel used to reroute blood around a blocked artery. Arterial duplex ultrasound, a non-invasive test combining ultrasound and Doppler for visualizing arteries. Blood pressure gradient, the pressure difference driving blood through arteries from high to low areas. Wind-Kessel effect, the elastic buffering of blood flow by large arteries to maintain continuous circulation. Endothelial dysfunction, when artery linings fail to regulate dilation and blood clotting properly. Vascular tone, the state of contraction of arterial smooth muscle influencing blood pressure. Pulse wave velocity, a measure of arterial stiffness. Higher values indicate cardiovascular risk. Arterial compliance, the ability of arteries to expand and contract with pressure changes. Aortic arch, the curved portion of the aorta that gives rise to major arteries of the head and arms. Arterial remodeling, structural changes in arteries due to long-term pressure or flow alterations. Tortuosity, twisting or curving of arteries, often age-related. Collateral arterial network, backup systems of blood flow in case of primary artery blockage. Transradial access, insertion of catheters through the radial artery for procedures. Femoral access, a common route for inserting catheters through the femoral artery. Arterial graft, a surgical replacement of a damaged artery using artificial or biological material. Vascular stenosis, narrowing of arteries reducing blood flow. Arterial plaque, fatty deposits that build up within arteries and restrict flow. Plaque rupture, when an atherosclerotic plaque breaks open, potentially causing a clot. Endarterectomy, surgical removal of plaque from the inner arterial wall. Vascular surgeon, a specialist in diseases and surgeries involving arteries and veins. Perfusion, the process of blood flowing through capillaries to tissues. Microcirculation, the flow of blood through the smallest arteries, arterioles, and capillaries. Intima media thickness, IMT, a marker of arterial health measured via ultrasound. Bruit, a whooshing sound heard over an artery, indicating turbulent blood flow. Arterial cannulation, insertion of a tube into an artery for pressure monitoring or sampling. Pressure waveform, the graphic display of pressure changes in arteries over time. Shear stress, the force of blood flow acting on arterial walls influencing vessel health. Hemodynamics, the study of blood flow through the circulatory system, especially in arteries. Arterial tree, a branching network of arteries that distribute blood throughout the body. Resistance vessels, arterioles that play a key role in blood pressure regulation. Pulsatile flow, rhythmic blood flow corresponding to heartbeats, prominent in arteries. Mean arterial pressure, MAP, an average blood pressure value indicating overall perfusion. Anastomotic loop, a looping connection between two arteries for blood redundancy. Endothelin, a powerful vasoconstrictor produced by artery linings. Prostacyclin, a molecule that dilates arteries and inhibits clot formation. Vasculogenesis, the formation of new arteries during embryonic development. Angiogenesis, the growth of new blood vessels from existing arteries, important in healing and cancer. Thank you for joining us on this relaxing yet powerful journey through the intricate world of arteries. From the mighty aorta to the tiniest arterioles, arteries form the living highways of the human body, pulsing with every heartbeat, nourishing every cell, and adapting with intelligence and resilience. Subscribe and like for more medical videos.